By show of hands, how many people here are afraid of spiders? A few, okay. What about heights? I am terrified of heights. Okay, here's a big one. By show of hands, how many people here are afraid of getting a medical bill in the mail? Pretty much all of us. In fact, the thought of getting a medical bill in the mail is the number one financial fear for most Americans. People worry more about whether or not they can afford their medical bills than whether or not they can afford gas for their cars, a roof over their head, or even putting food on the table for their families. It's no wonder that 62% of all personal bankruptcies are related to the inability to pay for medical expenses. And I think that it is primarily for three reasons. Number one, the billing system in our country is so convoluted that 99% of the time we have no idea what the heck we are even being billed for, right? Number two, because our insurance policies, if you're even lucky enough to have health insurance, are so confusing that 99% of the time we have no idea what they do or do not cover, and we're the ones paying a hell of a lot of money for them. And number three, because we've been led to believe that we have to pay whatever they tell us to. Well, I'm here to tell you, specifically with regards to number three, that nothing could be further from the truth. We, the consumers of healthcare, have more power and more control than we realize, and certainly more than we have ever been led to believe. And the powers to be, the ones who are fighting every day, we even have lobbyists in Washington fighting every day to make sure that the current healthcare system continues to run the way that it does. Oh, they are terrified of the day that we realize that and that we step into that power. Because that is the day that our healthcare system will begin to turn upside down and become patient-focused instead of profit-focused. In fact, John Mackey, the CEO of Whole Foods, even said that change will come to our healthcare system when the consumers control their healthcare dollars and begin exerting massive pressure from below. Well, I believe that that time is right now, and I believe that the FIRE movement is perfectly positioned to lead the way. Now, you may be saying to yourself, Angel, who the heck are you, and how can you make such a bold statement? Well, for one, I have worked in the healthcare system for over 43 years. Even though I may only look like I'm 20 years old, okay, maybe 30. When I was 13 years old, I actually had that uniform. I started out as a candy striper. Now, you know I say that very slowly, because if I add one more P, it becomes an entirely different profession. I eventually went on to become a registered nurse and then ultimately a family nurse practitioner. Where's my nurses in the house? Whoop, 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 whoop. And I loved being a nurse. It was who I was gonna say it was who I was, but it's who I am. But then something pretty significant happened that totally and forever changed the trajectory of my career. In 2015, I became acutely aware of the dichotomy that exists between how much money hospital CEOs make versus how little money the nurses standing at the bedside make. And then I became aware of how much money pharmaceutical company CEOs make, and yet I personally knew patients who had to ration their insulin, a formulary that hasn't even changed since 1921 when it was introduced, because they couldn't afford their medications. And then I became aware of the fact that in our country, we have over 30 million people who cannot afford health insurance, but yet the take-home pay for the CEO of Cigna Health Insurance makes over $30 million a year. There are a lot of people making a lot of money off of the individuals that the system was designed to serve. And I, for one, could not be a part of that system any longer. I decided that I was going to use all of my nursing and medical experience to fearlessly do whatever was necessary to put an end to these injustices and to make a difference in this world. In 2016, I acquired a medical fraud investigation company that had been around for 20 years. Who knew companies like this even existed? I went on to rebrand the company as Overbrook Consultants to pay homage to the neighborhood that I grew up in, West Philadelphia, born and raised. Yeah, Fresh Prince Will Smith was my neighbor. Yeah, not right next door, a street over. And over the years, why I chose Overbrook is because that's the community that built me. That is where I learned the importance of community, of sharing your resources with people, of watching out for one another and having your neighbor's back. Now, not all of us live in communities like that anymore, but I still believe that we all have a responsibility to share our resources and our information with each other so that we can have each other's backs. Over the years, my company has saved our clients, the insurance carriers, over $30 million, which is good, right? Well, the bad news is that we were able to do that because our data, 26 years worth of data, showed us that 93% of the medical bills that we reviewed for the insurance carriers contained errors and or fraud. And then, as if it couldn't get any worse, I then learned that all that money we were saving them was just going into their already deep pockets. That money wasn't being relayed down to us, the consumers of healthcare. We're still paying high premiums, we're still paying high deductibles, we're still paying high out-of-pocket expenses, not to mention the cost of prescriptions. So let me tell you, even though I now live in Nashville, Tennessee, and I'm trying real hard to be a Southern lady, well, the Philly in me came out, or maybe it was the Italian, I don't know which one it was, but I was like, oh, hell no. There was an F in there, too. Not on my watch, because I believe that I do have a personal and an ethical responsibility to share all of my knowledge and resources with each and every one of you here today so that I can have your backs. You need to know that you are at risk, and what you don't know is costing you a lot of money. So over the next 15 minutes, I would like to share with you what medical billing fraud and abuse is, who can commit it and how, what the 4 most common types of billing fraud are, and most importantly, what you can do to protect yourself. So what is medical abuse? Medical abuse is anything that results in an unnecessary or excessive cost to a payer, whether that payer is an insurance carrier, a self-insured company, or even a cash pay or self-insured individual. So an example of abuse would be if you've ever been admitted into the hospital and you were looking at your itemized bill, you would have seen on there that you got a charge for roughly $20 to $25 for a mucus recovery system. Now that sounds pretty fancy, doesn't it? Yeah, it's a box of tissues. Now, it's not considered fraud because you did get the tissues, but what they charged you for them is considered abuse, and hospitals are notorious for raising their prices for services and supplies by 400 to 500%. Yeah, yeah. Now, fraud, on the other hand, is knowingly and intentionally trying to get paid for something that they have no right to. So an example of fraud would be if you went to see your provider for a sore throat and they spent maybe 5 minutes with you, but then when you got the bill, you saw that you were billed for a pneumonia visit. That is called upcoding, and that is fraud, because they are knowingly trying to get paid for treating you for something at a higher acuity level, therefore more expensive, than what you actually received. So who can commit fraud and how? Well, sadly, anybody within the healthcare system can commit fraud. It could be a hospital system, it could be a provider, it could be a pharmacy, ambulance, home health agency. The list is endless. You know, I just want to preface this, and I didn't include this in my speech, but I was talking to somebody earlier. My goal is to not have you distrust your provider or your system. My goal is to have you be more intentional with who your providers are and to have a more collaborative relationship with your providers and to be reading your medical bills, whether it's for errors, abuse, or blatant fraud. So that's the whole intention here, and I just wanted to add that in there. But, excuse me, an example of ambulance fraud would be if you've ever been transported to a hospital via BLS, which means basic life support, meaning there was not a paramedic on board, but then when you got your bill, you saw that you were billed for ALS, meaning advanced life support, that there was a paramedic on board, that's considered upcoding as well. This actually happened to a friend of mine. Her husband broke his foot at work, and he just needed a basic life BLS transport to the hospital. But then when her bill came in, she saw that she was billed for ALS. And the difference between BLS and ALS in her situation was $1,000. She saved her family $1,000 just by reading her medical bill and making one phone call. Now, how this could play out in a larger system with a hospital system, there is a hospital that has to pay $260 million, which, come on, that's a slap on the wrist for them, but they have to pay $260 million to resolve allegations of fraud. And one of the things they did was they aggressively pressured, with threats of termination, their emergency room physicians to admit anybody over the age of 65, whether or not it was even medically necessary. Why did they do that? One word: greed. So that they could bill our Medicare system for medically unnecessary admissions, tests, and treatments. But the bottom line, guys, who pays for Medicare? We do, exactly, the taxpayers. So, brings us to our next topic. What are the 4 most common types of billing fraud? They are billing for services not delivered, double billing, upcoding, and unbundling. So, billing for services not delivered. Now, I think just the name of these alone is pretty self-explanatory, but I like giving examples for each one because I think if we're able to visualize something, we are better able to understand it and then remember it when we're looking at our own bills. So, billing for services not delivered. Last year, my mother received a bill for $500 for an office visit. And at first, she didn't pay much attention to it because she has really good health insurance. But then a few days later, that bill just kept festering in her head. So she went back and looked at it and saw that on that date of service, she wasn't even in the state on that date. My parents live in Philadelphia. They were at their house in Florida on that date of service. Another example of being billed for services not delivered involves yet another relative. My family's good for stories. And I was trying to explain to my sweet little 80-year-old aunt what I do for a living. And she was kind of like, yeah, I know, like almost dismissive. And I was like, do ya? Do you really understand what I'm saying? And she said, yeah, I do, smarty pants. It's like when I go to the doctor's every month and he bills me for an EKG. So I'm like, well, you are 80 years old with a cardiac history. The fact that he's doing an EKG every month is excessive, maybe abuse, but that's not fraud. Guess what she says? Oh no, he only does an EKG at my annual visit. So at first I was like, holy crap, you really do understand what I'm saying. But then I was like, well, did you ever question him as to why he's charging you every month? And she said, oh, I didn't know I was allowed to. Now, how many of us feel like that? Like we're not allowed to question the medical billing system or a hospital or our providers. It's our hard-earned money. We can question whoever we want, which is why I always say, you don't have to pay for anything until you understand and agree with everything. And you do that by asking as many questions as you want to whoever you want. The next most common type of billing fraud is called double billing. Self-explanatory. An example of this one is we were reviewing the medical records for a client of ours, and I knew he had a same-day procedure done. So something just kind of caught my eye, and I questioned something, and I called him and I said, hey, how many IVs did you have? And he said, 1, why? I said, okay, because you were billed for 6. Now, could that be a case of simple human error? Absolutely. But we wouldn't even know about it unless he requested an itemized bill, which lists out item by item by item, everything you're billed for, and then we were reviewing his bills line by line by line. The next type of billing fraud we see is upcoding. Like I mentioned earlier, this is if you see your provider for a sore throat, but then you see that they billed you for a pneumonia visit. Or the most common thing that we see is if you made an appointment to see your provider, the physician, but then the day you go, you see the physician's assistant or the nurse practitioner, which is perfectly fine, but then when you get the bill, you see that they billed you for the provider. That's called upcoding, because they are knowingly trying to get paid for treating you at a higher skill level than the individual that you actually saw. And then the fourth most common type of billing fraud is called unbundling. And there are certain tests and procedures that are always billed together and clumped together and billed as one unit. Now, typically we see this with supplies, surgical supplies, or even lab studies. This one can be a little trickier and harder to identify, but an easy way to understand unbundling is, let's say you went to a fast food restaurant and you said to the cashier, I'll have a number 7 value meal, please. And she says, okay, that'll be $72. And you're like, what? Well, sure, because they're charging you for the cup, the lid, the ice, the drink, the straw, the bun, the one pickle that you get. That's called unbundling. So the next time you have blood work drawn or a surgical procedure done or anything like that, if the charges seem really excessive, you want to request an itemized bill, because that will list out everything. And if you see just a whole bunch of items listed, reach out to your insurance carrier or to us and say, hey, is this an example of unbundling? And we or your carrier could identify it just like that for you. So now that you know the 4 most common types of billing fraud, the next time you open up a bill and just pay it without looking for one of these at the bare minimum, you are running the risk of giving your hard-earned money to somebody who never even earned it, or worse yet, to somebody who intentionally set out to take advantage of you. The last thing I'd like to leave with you is a framework that I've created, and it's called the DOVE system. And it stands for Document, Organize, Verify, and Engage. And by utilizing this framework, not only will you be and feel more in control of your medical expenses, but you will have financial peace of mind knowing that you are keeping your hard-earned money where it belongs, in your pockets. The first step of the DOVE framework is to document. You know, somebody once said that the problem with keeping mental notes is that the ink fades very quickly. So let me ask you a question. If you were to see your provider in January, but the bills don't start coming in until June, July, or August, are you really going to remember what transpired 8, 9 months earlier? Heck, I can't remember what I had for lunch yesterday, let alone 9 months ago. Which is why documenting is the first step of the DOVE framework and the most important part of becoming a better consumer of healthcare. We need to begin documenting everything that occurs from the moment we make an appointment or step foot into a hospital all the way through until that bill has been paid in full. This way, should you ever need to question anything, documenting is what gives you a leg to stand on. Otherwise, it's just your word against theirs. The next part of the DOVE framework is to be organized. Now, how many of us have ever gotten a medical bill in the mail and we just throw it in the pile with the rest of the bills to be dealt with later? Or how many of us have ever written something down on a piece of paper so we can remember something later, but then we can't remember where we put the paper? To become a better consumer of healthcare and be more on top of and in control of our medical expenses, we need to have a way to keep everything organized and in one place. This could be a binder, it could be an accordion folder, or based upon your needs, it could be a small filing cabinet. Now, this is especially important if you yourself have multiple providers or if you are the one responsible for the healthcare needs of somebody else, such as a child, a spouse, or even our elderly parents. Having an organized way of keeping all of your medical-related information and expenses will help you be and feel more on top of and in control of your medical journey. Third part of the Duff framework is to verify. Our first thought whenever we get a medical bill should never be, oh my God, how am I going to pay for this? Our first thought should be, is everything correct? Is everything accurate? Why? Because 93% of the medical bills you get in the mail could contain blatant errors and/or fraud. But we wouldn't know that unless we were reviewing every medical bill we receive, excuse me, looking for the 4 most common types of billing errors that we just went over, and then cross-referencing it to what we had documented back in step 1. Now, I know there's a saying that says we are innocent until proven guilty. Well, when it comes to any bill that I receive, especially a medical bill, that sucker is guilty until I prove it as being innocent or accurate. And the last part of the Duff framework is to engage. And who you engage with is based upon whatever you did or didn't find while you were reviewing your medical bills. If you didn't find any errors and the charges seem reasonable, you would reach out to whoever generated the bill, whether it's your provider or the hospital system. But by all means, do not put it on a credit card, no matter how much they pressure you to do so, for 2 reasons. Number 1, that's going to wreak havoc on your credit score. And number 2, because why should you incur the interest on that? Instead, you want to ask your provider or the hospital what type of interest-free payment plan they have. And they all have one, they just don't tell you about it. And then you make your payments directly through them interest-free. Now, if you did find errors and/or fraud, well, here is where your ninja negotiating superpowers come in. First thing you're going to want to do is, now look, if you want to make a phone call, you can, but quite frankly, my time's more valuable than that, and so is yours. So you want to do this in writing, and you want to send it return receipt requested. Why? Because they have to respond to any written request within 30 days. That's the law. They have to. And you want to send return receipt requested so that then you have documentation that that was sent and that it was received. And in the letter, you want to be very clear and very succinct. And you have to have the mindset of, you kind of got to get your Philly on, like, hey, you're not bartering with them at this point in time. You're now calling them out on the fraud or the errors that you found. So you got to have the mindset of, hey, you double billed me, overbilled me, charged me for something I didn't receive, whatever. Now, you know it was wrong, and I'm giving you a chance to rectify it before I report you to the authorities. Now, that's the best Philly I could do. I'm in the South too long. Y'all, bless your heart. Which has 2 meanings, just so you know. I learned that the hard way. And you want to have that mindset so that you don't get intimidated when they push back, which they will, because that's their job to do so. Throughout the entire process, though, I would please encourage you to remain calm, kind, and respectful with whoever you are dealing with, for 2 reasons. Because we all know that the first one to lose their cool loses. And number 2, because as human beings, we all genuinely want to help people who are nice to us. So the bottom line, don't kill the messenger on your way to challenging a broken system. I'd like for you to picture a day when you are no longer afraid of getting a medical bill in the mail. And then I want you to picture a day when you feel confident and in control of your medical expenses. And then I want you to please picture a day when you can retire on your terms with your money where it belongs, in your pockets, and not somebody else's. As a consumer of healthcare, we have more power and more control than we realize, and certainly more than we have ever been led to believe. And I believe that when we step into and stand in that power, we will be able to turn this current healthcare system upside down to become patient-focused instead of profit-focused. And I want to encourage each and every one of you here today to join me on that mission, because we are the people we've been waiting for. Thank you.